Hi, and welcome. I'm Patty Hodge. I'm a nurse practitioner in psychiatry, doctor of nursing practice, retired. Welcome to my channel. This is called Dr. Nurses Rock. If this is your first time here, please go to my welcome video to see what this channel is about. Today, I'd like to briefly talk to you about some very important issues related to low mood. If you have a low mood for a persistent period of time, it might be something that requires treatment. But there are other things that can contribute to sadness. So let's look very quickly at what symptoms you should be looking for that may require some extra professional attention. The blues happen. Sometimes a life situation occurs that makes us feel sad, out of control, wondering what to do next. Those kinds of things can be a breakup, a loss of a job, maybe a loss of income, maybe loss of friendship, something to do with loss or a change that you really have no control over. That is a situational thing. Usually, when the situation is resolved, your mood improves. That's really not what I'm talking about today. Today, I'd like to talk about two other situations that might contribute to prolonged sadness or prolonged symptoms that can be called a depression. The first is grief. We all have some period in life of having to face the facts of life, the fact that we lose people we love, or pets that we love, or something important to us. And grief can cause us to feel many of these symptoms that I'm going to describe as depression. Again, if those symptoms persist, or those feelings of sadness or loneliness or emptiness, or even for severe grief where you just can't concentrate or things are just not going your way, that also might require some professional assistance to help you move out of that. Or a good therapist will walk with you through that process. Today, I want to really address the three big types of depression that have symptoms that you might not even recognize as going on inside of you, and someone else may point that out to you and help you come to terms with the fact that you are depressed and you need some help. So there are several different kinds of depression, and a lot of people are not aware of that. So the three that I want to talk to you about today are called dysthymia, major depression, and bipolar depression. So these symptoms can overlap. Sometimes it's a question of duration of symptoms and other symptoms that may accompany it, which will help a professional make a distinction to understand which one you may be suffering with. So, the reason that I want to discuss depression is that it is a very common disorder, but it also has dire circumstances for some people, especially if there are thoughts of self harm. So, let's review very quickly what those symptoms are that you should be aware of and when you really should ask for some help. The first is if you're feeling very sad or empty, and sadness for no really recognizable symptoms, issue around you. So, for instance, the loss that we talked about, grief, there's a recognizable issue there. But how about if you just wake up and, wow, like you cry for no reason and it goes on for days and maybe weeks? Um, how about that feeling of emptiness, or I just can't feel happy. I don't know what happened to the happy button, right? You may start to feel hopeless or helpless. Okay, there are situations in life where things feel like I have no control over this. And that's something that may or may not be depression, and it may be very real. There are a lot of things we don't have control over that can help us feel hopeless or helpless. But if that seeps into other areas of your life, I really don't know how to deal with anything anymore. That's pretty serious. There are times when you might feel very worthless, where you're burdensome to other people. Okay, those three symptoms right there some bells should go off. Um, Other symptoms are feeling excessively guilty without really having a cause for feeling guilty. We all do things that we regret, that we have some remorse about. But if this goes on and you start to feel guilty about everything, this is something to pay attention to. A fifth issue is not feeling any pleasure in things that used to give you a lot of pleasure. Perhaps, visiting with friends. You just don't want to do it anymore. You just don't want to engage in hobbies that used to engross you and make you feel really good. Maybe it has to do with relationships, sexual issues where you're feeling like, I just don't enjoy that. I don't want to be around other people. I don't want to engage with anybody. Okay, that's something to look out at, especially in a constellation of symptoms like the ones I'm describing. Next is irritability or anger. Maybe you're just an even keeled person and it's very unusual for you to be so irritable. Everything just irritates you. And you become very cranky and people start to notice. And it depends on age here. Often depression will show itself in children this way. So this is not just about adults, although that's the only population that I ever treated, but perhaps you're a parent or a grandparent and you're seeing these things in your child. That is a red flag, and you need to look for professional assistance to assess that. Another symptom is feeling tired and having no energy at all. And that's even if you're eating and you're getting up and you're going, somehow or another that sense of energy is just gone. And maybe your sleep has changed. You get oversleeping or not getting enough sleep or disturbed sleep. You may have difficulty concentrating. You can't remember things the way you used to. Maybe you can't make decisions the way you used to. Maybe you just don't have an appetite anymore and food really turns you off. You may lose weight or gain weight. Your appetite changes so much, maybe you're just overeating, meaning that you're looking for food to quell some of this discomfort that you're feeling. You'll be gaining weight if that's the case. Something else you may not realize is a sign of depression are aches and pains and physical symptoms that are really just not understandable. Um, you're getting headaches, you're having indigestion, you're feeling your whole body just aches. And maybe you've been to your physician and they're not finding some real physical cause for these things. Another symptom, you can't switch off your brain. That's overthinking. That may happen when you're trying to rest, which may interfere with your sleep. It may even interfere with your relationships. And probably the most severe symptom of all is when you have thoughts of death, not just normal ideas that okay, we're human and we're all going to come to some end at some point or another. It's like becomes a preoccupation and thoughts of self-harm or suicide. You feel like life doesn't have any meaning anymore, and you may have some idea or hear someone express an idea of harming themselves or ending their lives. This is a life-threatening disorder, and this requires the attention of real, competent medical assistance. So, the reasons that we put this information out into the world is there is help. And if you recognize these symptoms in yourself or in someone you care about, it's time to step up and do something to help yourself or to help that person that you love. It's very difficult to live with a depressed person. And one of the things I spoke about in an earlier video that I had done was the whole idea of being an adult child in a dysfunctional family or an ACOA person. That's a 12-step program that I talked about in one of my earlier videos here on this channel. Often when we're raised by a depressed person, we take on some traits or we take on, this idea that somehow we need to help that person, even though that's way out of our scope and ability to do. So these are things that I wanted to put out there because I'd like to hear if you recognize these symptoms, if you've seen them in yourself or someone else, and if you're getting help. The last piece of this that I'd like to speak about is who is really trained to help you overcome these kinds of depressions, these low moods that don't go away, or those thoughts and things that seem out of your control. So, the people who can help you recognize depression, diagnose depression, treat depression, you might start with your regular medical provider. If you have regular blood work and regular physicals and things are in order, your blood work is good, you're not showing signs of illness or anemias or things that might be contributing to this low energy or sleep problems or thyroid issues or whatever, that person might be the first to say, maybe you're depressed. And some doctors and nurse practitioners and physician's assistants can recognize these symptoms and can be the first line of defense in helping you treat it with some kind of medication. The next line would be some kind of talk therapy or psychological help. So, a psychologist, a trained clinical social worker, or trained clinical mental health counselor. Now, it depends on your area uh, and your state that you live in, how these people are licensed and how they're trained. But for the most part, look for someone who has some experience working with mental health disorder. So the end thing here is recognizing the symptoms, loving yourself enough to say, I don't want this to go on this way, and I'm willing to get some assistance. Or seeing these symptoms in someone that you love and saying, hey, look, let's take care of this because I care about you and I want you to live a long, healthy life. So the other things to think about in these situations are sometimes you have a specific kind of illness in mental health that has depressive symptoms attached to it. The symptoms that I listed above are usually recognized as major depressive disorder. You can also have these symptoms in a lesser form for a long period of time, and that would be called a dysthymic disorder. And for the most part, mostly women are affected by that. And you might not really accept it as depression because you're functioning. You get up, you take care of the house, you go to work, you have a family, you have interests, but you know something is not right in your mood and you know it's been this way for maybe even years. And the other illness, the main illness in mental health that we look for in these with these symptoms are bipolar disorder, because bipolar disorder means there are two poles, right? Bipolar. So there's a manic piece of this where the mood is elevated and people may be involved in risky behavior and all the other things when they're in a manic phase. And the other side of that is depression, because you'll hear that term, manic depression. So that also is treatable with medication and with a competent therapist who can help you look at the issues to make your life run more smoothly in a way that brings you more joy and more control over yourself and your emotions. I hope that this information was helpful to you. What I would like, please, is for you to hit the subscribe button if you haven't so far. Those numbers of subscribers helps the channel to grow, and it helps YouTube to recognize these videos in their algorithm so that they can go out to more people. And I'd really love your help in making this channel more available to other people. Thanks so much for listening. Leave a comment, hit the like button. I hope to see you again soon. Be well.